struggling to lose weight, stay energized, or control sugar cravings. It might be insulin resistance, an overlooked condition affecting millions. In this video, we'll explore its symptoms, causes, and impact on your body. Learn how to spot the signs and take charge of your health. Make sure to like, subscribe, and hit the bell for more wellness insights. Stay tuned to uncover the key to better health. 1. Persistent fatigue. Persistent fatigue is often one of the first and most noticeable signs of insulin resistance, leaving you feeling drained even after a full night's rest. Insulin resistance hinders your body's ability to effectively move glucose into your cells, which is necessary for energy production. As a result, your cells remain starved for energy, causing you to feel tired all the time. This fatigue can worsen after meals, particularly those rich in carbohydrates, as your body struggles to process the excess glucose. Over time, the lack of efficient energy utilization can affect your overall productivity and mood. You may also notice difficulty concentrating or completing everyday tasks due to the constant feeling of exhaustion. 2. Increased belly fat. Increased belly fat, also known as visceral fat, is a common physical manifestation of insulin resistance and a significant health risk. When your cells don't respond well to insulin, excess glucose is stored as fat, particularly around the abdomen. This type of fat is more than just cosmetic, it's metabolically active and associated with increased inflammation, which can exacerbate insulin resistance. Even if you follow a healthy diet and exercise, you might find it particularly challenging to shed weight around your midsection. Visceral fat is also linked to other complications such as heart disease, type 2 diabetes, and hormonal imbalances. 3. Cravings for sugar and carbohydrates. Cravings for sugar and carbohydrates can become overwhelming for individuals with insulin resistance, creating a cycle that worsens the condition. These cravings arise because your cells are unable to absorb glucose efficiently, leaving your body constantly searching for quick sources of energy. After consuming sugary or carb-rich foods, your blood sugar spikes rapidly, only to crash shortly afterward, triggering even more cravings. This cycle can lead to overeating, weight gain, and further insulin resistance. Managing these cravings requires focusing on high-protein, fiber-rich meals that promote stable blood sugar levels throughout the day. 4. Difficulty losing weight. If losing weight feels like an uphill battle despite your best efforts, insulin resistance may be the culprit. When your cells resist insulin, your body stores more fat instead of burning it for energy, making weight loss especially challenging. This is further compounded by hormonal imbalances caused by insulin resistance, which can increase appetite and fat storage. Additionally, the body's inability to efficiently process glucose can leave you feeling fatigued, reducing your motivation to maintain an active lifestyle. The difficulty in shedding pounds can be frustrating and may lead to feelings of hopelessness. 5. Skin changes. Skin changes, such as dark, velvety patches known as acanthosis nigricans, are a visible marker of insulin resistance that often appear on the neck, armpits, or groin. These patches occur due to elevated insulin levels in the bloodstream, which stimulate skin cells to grow faster, leading to thickened and darkened areas. While these patches themselves are harmless, they can be an early warning sign of underlying metabolic dysfunction and should not be ignored. Over time, untreated insulin resistance can lead to more serious complications, including type 2 diabetes. Treating these skin changes often involves addressing the root cause insulin resistance through dietary and lifestyle modifications. 6. Frequent hunger. Frequent hunger, even after eating large or balanced meals, is a classic symptom of insulin resistance. When your cells fail to absorb glucose effectively, your body perceives a lack of energy and signals hunger as a way to compensate. This can lead to overeating and a preference for quick-digesting carbs and sugary snacks, which only worsen blood sugar fluctuations. Over time, this cycle contributes to weight gain and further insulin resistance. Managing frequent hunger involves adopting a diet rich in protein, fiber, and healthy fats, which promotes satiety and stabilize blood sugar levels. Including snacks like nuts, seeds, or Greek yogurt can help curb hunger between meals. 7. High blood pressure. High blood pressure is a silent but serious consequence of insulin resistance, affecting both your cardiovascular and metabolic health. Elevated insulin levels in the blood can cause the kidneys to retain sodium, leading to increased blood volume and higher blood pressure. Over time, this strain on the cardiovascular system can increase your risk of heart disease, stroke, and kidney damage. Insulin resistance also promotes inflammation and stiffening of blood vessels, further exacerbating hypertension. Regular monitoring of your blood pressure is essential, particularly if you suspect insulin resistance or have other risk factors. 8. Brain fog. Brain fog, characterized by difficulty concentrating, forgetfulness, and a lack of mental clarity, is a common but often overlooked symptom of insulin resistance. The brain relies on glucose for energy, and when insulin resistance disrupts glucose metabolism, cognitive function can suffer. You may feel like your mind is sluggish, making it harder to focus on tasks or process information quickly. This can affect your performance at work or in daily activities, leading to frustration and reduced confidence. Chronic inflammation caused by insulin resistance may also contribute to brain fog and increase the risk of neurodegenerative conditions over time. 9. Polycystic ovary syndrome. For women, insulin resistance is a key factor in the development and progression of polycystic ovary syndrome, a condition characterized by hormonal imbalances. Insulin resistance increases androgen production, which can lead to symptoms such as irregular menstrual cycles, acne, and excess hair growth. These hormonal disruptions can also make it difficult to conceive, as they interfere with ovulation. The presence of insulin resistance in polycystic ovary syndrome can further exacerbate weight gain, fatigue, and cravings, creating a cycle that worsens overall health. Managing insulin resistance through a low-glycemic diet, regular exercise, and medical interventions can significantly improve polycystic ovary syndrome symptoms. 10. Elevated blood sugar levels. Elevated blood sugar levels are one of the most definitive indicators of insulin resistance, often detected during routine blood tests. When your cells fail to respond properly to insulin, your pancreas compensates by producing more insulin, but this can only keep blood sugar levels stable for so long. Over time, blood sugar levels begin to rise, leading to prediabetes or type 2 diabetes if left untreated. Elevated blood sugar can cause symptoms such as increased thirst, frequent urination, and blurred vision, but it may also develop silently without noticeable symptoms. Regularly monitoring your fasting blood sugar and hemoglobin A1C levels can provide early clues about your metabolic health. Understanding the signs of insulin resistance can help you take proactive steps to regain control of your health. If you recognized any of these symptoms in yourself, now is the time to act by adopting healthier habits and seeking guidance from a healthcare professional. Don't forget to like this video, subscribe, and share it with someone who might benefit from this information. Together, we can build a healthier future. See you in the next video.